Hello everyone. Welcome back to part 2 of my presentation. As I stated in part 1 of my presentation, our vision is a nation where all people enjoy good oral health that contributes to leading healthy, satisfying lives. In order to achieve this vision, we have created the strategic plan. Our strategic plan will set the direction and priorities, have all the stakeholders work together, implement the programs, and continue evaluating and improving the programs to achieve our ultimate goals. These are the 8 goals we set. Tooth decay is almost completely preventable, yet when people do not see a dental provider, they do not get the preventive services and early diagnosis and intervention that can halt or slow the progress of most oral diseases. The issue of lack of access to dental care is extremely serious because untreated oral diseases can lead to not only pain, infection, and tooth loss, but also contribute to an increased risk for serious medical conditions. Our core functions are to monitor the burden of disease, risk factors, preventive services, and other associated factors, to support public health research that directly applies to policies and programs, to communicate timely and relevant information to impact policy practices and programs, to support the implementation and maintenance of effective strategies and interventions to reduce the burden of oral diseases and conditions, to build capacity and infrastructures for sustainable, effective, and efficient oral health programs, to evaluate programs to ensure successful implementation, to investigate health hazards and outbreaks in a community, to identify and facilitate partnerships to support CDC strategic priorities and community efforts, and to develop and advocate sound public health policies. Let's take a close look at our goal number 1, prevent and control dental caries. Despite our efforts, dental caries continue to be a major problem for Americans. 96% of adults aged 50 to 64 years have had dental caries. More than 1/4 of U.S. children aged 2 to 5 years and half of children aged 12 to 15 years are affected by tooth decay. About 2/3 of children from low-income families aged 12 to 19 years have had caries. Community water fluoridation has been identified as the most cost-effective method of delivering fluoride to all members of the community, regardless of age, educational attainment, or income level. Drinking fluoridated water keeps the tooth strong and reduces tooth decay by 25%. Because of its contribution to the dramatic decline in tooth decay in the United States since the 1960s, CDC named community water fluoridation one of the 10 great public health achievements of the 20th century. Sealants prevent tooth decay and also stop cavities from growing. The Surgeon General's report on oral health indicates that sealants can reduce decay in school children by more than 70%. Although preventive interventions such as water fluoridation and dental sealants have made much progress in reducing the burden of dental caries over the past 40 years, there are barriers. This Surgeon General's report has much to say about the inequity and disparities. The barriers to oral health include lack of access to care, whether because of limited income or lack of insurance, lack of transportation, or the flexibility to take time off from work to attend the personal or family needs for care. Individuals with disabilities and those with complex health problems may face additional barriers to care. Sometimes, the public, policymakers, and providers may consider oral health and the need for care to be less important than other health needs, pointing to the need to raise awareness and improve health literacy. The evidence that not all Americans have achieved the same level of oral health stands as a major challenge. So, we will continue monitoring and evaluating our programs and continue making efforts to improve the level of oral health. To conclude, our vision is a nation where all people enjoy good oral health that contributes to leading healthy, satisfying lives. In order to achieve that, we will keep making efforts to provide national leadership to prevent and control oral diseases and conditions and promote oral health. Thank you.